my name is Jessica. I'll be your nurse today. I will be doing a head-to-toe assessment on your baby. Can you just verify your name and date of birth? Great, and I'm going to check your baby's name and date of birth on their wristband. Okay, great. So we just did your baby's vitals. So now what we're going to do is a full head-to-toe assessment. We're going to basically start from the head to the toes, okay? And I'll update you as we go. Okay, let me do my hand hygiene, put some gloves on. Great. So now we're gonna start at the general appearance, okay? So I'm just gonna look at your baby and just see what they're doing, see how they're acting. Right now your baby is resting in the bassinet. There's no hyperactivity, there's no tremors, nothing like that. Your baby's just resting. I'm also just gonna look at the skin of your baby. Just start from there. Look at the skin turgor, make sure they are nice and hydrated. Also looking for any abnormalities, any rashes, spots, birthmarks, anything like that. I'm just kind of looking at the general appearance of your baby. The Mongolian spot, which is back here, it's like a dark purple spot on their back, which is normal. Your baby doesn't have any rashes or a couple birthmarks right here, but nothing to have any concern about. Now I'm going to start at your baby's head. So we're going to start at the scalp. I don't have a cameraman today, so let's just try. So we're going to start your baby's head. I'm going to look at the fontanelles, make sure that there is no overlapping. Make sure there's no masses, there's no hematomas, nothing crazy from birth. Everything is symmetrical and there is nothing to be concerned about. Make sure that the sutures are palpable and not separated or overlapping, which they're not. And then I'm going to move to the eyes and I'm going to just assess the eyes basically for the symmetry and shape. Make sure that there's no abnormalities with the eyes. Okay, and then I'm going to move to the ears and basically looking for no drainage. Make sure that the cartilage is nice and formed. There's no holes or like pits in them. And your baby's ears look nice and well, nicely formed. And then I'm gonna look at the nose, make sure your baby is using their nose to breathe, of course. Make sure there's no flaring or obstruction, no drainage. Just make sure everything looks good and that they can breathe through their nose. And then I'm going to look at their mouth, inside their mouth. I am going to assess their sucking reflex and make sure that there is no abnormalities with their mouth, like the cleft palate. I'm going to feel the roof of their mouth, see if there's any holes. Also their gums, their gum lines, to assess for the Epstein pearls. Or sometimes babies are born with teeth. I was born with 2 teeth, so it's pretty interesting. And make sure that there's no white patches on the tongue. Make sure the tongue's not protruding, that their tongue is nice and secure in their mouth. And your baby looks great. So now I'm gonna go to the neck and make sure that everything is symmetrical. They should be able to move freely from side to side, which your baby is doing. Make sure there's no webbing or anything like that. And your baby looks great there. And then I'm gonna go down to the chest and basically I'm gonna first just look and make sure that everything is symmetrical, that they are breathing how they should. There's no retractions or anything like that. Now I'm gonna listen to your baby's heart. Basically, again, listening for any abnormalities, murmurs, anything like that with the heart sounds. Okay, and you listen to the heart for 1 full minute, okay? Okay, great. So now I'm going to move down to the abdomen and I'm going to basically just look again and then I'm going to listen to the bowel sounds. okay. Just make sure there's nothing to be concerned about here. And then I'm gonna also just take a look and make sure that there is no masses, everything's symmetrical. Basically just anything to be concerned about. And also you ask the mom when their meconium passed, and basically when they voided, just keep track of their diapers the first couple of days when they're born. And I'm also, while I'm here, going to look at the umbilical cord base and make sure that there's no infection. Also educate the mama on how to care for that, make sure the diaper is below, make sure there's no bleeding, anything like that. Just the overall appearance of that as well. And then you check the genitalia, make sure that everything is developed, make sure there's no bleeding or anything like that coming from there. And then I'm going to check the extremities and basically make sure that everything is movable. There's no like clicks. The baby's not in pain when you're moving things, when you're moving their extremities. So I'm just going to do that and make sure everything is moving how it should. And then I'm going to look at their reflexes. I can just see if the baby will grasp my finger, and that will be the grasp reflex. And then I'm going to look at their hands, make sure that there's 10 fingers total, that there's no abnormalities there, no webbing, nothing like that. And then their feet, I'm gonna look again, see their appearance of their feet. You assess for like if they're flat-footed, if there's webbing, if they make sure they have 10 toes. And then you can do the Babinski reflex and make sure to go down their sole of their foot and then watch their toes fan. And that would be that reflex. And then you can do the Murrow reflex, where you're sitting them up and their head will go back a little and their extremities will go up. And then you'll go to, we did the sucking reflex. The stepping reflex is when you would sit your baby up like this as if they were walking, and their feet will basically do the walking motion. Make sure also to assess their head, make sure they have good head control, or as much as they can have good head control. And then I'm going to turn the baby over, got a big baby, and check the spine and make sure everything is midline, flat, palpable, there's no masses, everything is straight, and that looks great, and your baby is doing great.